Well, welcome back. It is 9:10. As you probably know, October is Breast Cancer Awareness Month, a time to remind women to get their mammograms. But do you know who looks at yours and what goes into reading it? And how does dense tissue complicate trying to make a diagnosis? Joining me with answers is Dr. Colleen Madden, Division Chief of Breast Imaging at IU Health. It's an honor to have you here this morning.
Thank you.
It's interesting to hear what you do. So as a radiologist, you're reading these mammograms. What are you looking for? Because to the rest of us, they just look foreign.
So when we interpret a mammogram, we're looking at multiple things. First of all, we're evaluating the density of your breasts. There are 4 different categories for density. There's fatty breasts, there's scattered breasts, there's heterogeneously dense breasts, and extremely dense breasts. And the breast is made up of primarily fatty breast tissue, fibroglandular elements, and fibrous elements. So if you have dense breasts, you're someone who has mostly fibroglandular and fibrous elements, which show up as white densities on the mammogram. If you're fatty, you're mostly mostly dark areas of fat on the mammogram, which make it much easier to interpret.
And so this is something you can look at it and you can tell right away.
Right, we look at that and then we also notify your physician, so you can find out in your report or from your physician which category of patient you fall into. And the reason why that's so important is with women who have extremely dense breasts, their cancer risk is 4 to 6 times greater than other women who do not have dense breasts.
A lot of people think, I don't have a family history, I don't need to do this every year, they get busy. Is that a myth?
That is definitely a myth. A lot of the patients we see, about 75%, have had no family history of breast cancer before. So that's why it's really important, even if you don't have a family history, to start screening mammography early. The American College of Radiology and IU Health recommend you start at age 40.
Well, I was telling her in the break I had stage 4 colorectal, no family history, nothing at all.
Right.
And it can be such a shock. You know, most women think, okay, I'll look for a lump, but that's not the only symptom. What else should people be looking for?
Well, other symptoms for breast cancer can not only be lumps, but they can be changes in the skin. They can be pulling in of your nipple. Pain is very rarely a sign of breast cancer. More common signs are dimpling in the skin and the nipple changes and the lumps. And the lumps on the mammograms appear as white densities. And unfortunately, if you have dense breasts, the dense breast tissue also appears as white densities. So it can be very hard to detect the lumps initially on the mammograms with dense breasts. So that's why so many women end up coming back for additional imaging, is so we can further evaluate those areas and try and find those early cancers.
I'm imagining you get the call and you need a second mammogram. The woman probably panics a little bit. What's the second one for? How's it different?
Okay, so the second one is different in that when you come in for your first mammogram, you get 4 routine views as part of the screening exam. When you come back, we specifically state in our reports that we may want spot imaging, where we use a smaller paddle. We really spread out the tissue to look at the area. The other thing we may do is what we call magnification views, where we really magnify images in the breast. And then finally, we may also proceed with an ultrasound to look and see if some of the masses that we're seeing, whether they're cysts or whether they're solid. If they're cysts, we know they're benign. If they're solid, then a lot of times we need to do a further evaluation with a biopsy.
People think the mammogram's so painful, and it can be, but it's much better than not knowing.
Well, and it's much better as time has progressed. The technology is so much improved from when I started that we can get much better resolution images with a little bit less compression. And I usually recommend women, if you're really having a lot of breast pain at the time you schedule your mammogram, maybe you might want to reschedule and wait till that subsides a little bit.
It was really great to have you come in, because I know you travel to so many locations of IU hospitals around, and this will certainly help someone.
All right,
so
well, thank you so much.
And we'll have a lot more information on our website, fox59.com/links, links to the different locations and all the advice you had. It is 9:15. Let's go over to, is it Jim?
Yep.
Oh, hey.